friends, today I would like to have a discussion with you about a condition I personally have been suffering with for 6+ months called golfer's elbow or medial epicondylitis. It is a painful condition on the inner side of the elbow and forearm. It causes pain and inflammation and sometimes numbness, swelling, and tingling in the fingers. Those are all symptoms I have experienced. But disclaimer alert before we go any further, I am not a physician. I am not a physical therapist. Any and all of these views are mine, and I'm just speaking from experience and what I have personally gone through. And some of these things may work for you, they may not work for you. So it is all based on individual results. Also, if you are having pain, I would suggest seeing your physician and getting a proper diagnosis and treatment plan. This is not intended to replace a proper diagnosis and treatment plan with your doctor. On to the next part. I would like to also preface the video by saying that Voltaren and Ace Bandage are not affiliated with me. I am not sponsored. It is not a paid sponsorship. I am a paying customer who has tried their products and I have had great results. So on to my background. I have been a certified physical fitness instructor for 25+ years. I love teaching live classes. It's my passion. I love to motivate people, help people feel their best, and just have fun with it. I cannot pinpoint what actually caused this injury. It is kind of like a repetitive strain disorder, doing the same movement over and over. And I know one thing, that there are some things that certainly make it feel worse. Opening doorknobs, shaking hands, washing dishes, anything where I'm twisting that elbow, that internal rotation, it causes pain. So now that we have that background out of the way, I would like to mention that this happened during the pandemic. I started to feel pain. I was coloring a lot with my daughter, and I would feel a little bit of a burning sensation in that elbow. And I was working out, and obviously gyms were closed, so I was not teaching live classes. I started my fitness YouTube channel during that time, and I really don't know exactly what caused it. It could have been a number of factors. It has caused a lot of frustration. If you're an active person like me with a very active lifestyle, it is very frustrating. You can get discouraged. I have been discouraged. I have shed tears. It just brings you down. You're not able to do the things you normally do, the things you need to do around the house. I can't carry loads and loads of groceries like I used to. I would load up both arms with all the groceries in the car and bring them up at once. That's just me being stubborn. So those things I cannot do anymore. And I went to an orthopedic doctor. He diagnosed me. He did an x-ray. The x-ray was perfectly normal. I had no problem with the bone. And he recommended trying naproxen, which is an NSAID, and it helped with some of the pain, some of the swelling. And when that was done, he recommended ibuprofen or Motrin. So I did that, and also icing 3 to 4 times a day for 15 to 20 minutes each time. And also I was given a packet of stretches and exercises to help strengthen and stretch out the area. I would do them faithfully until I felt too much pain, and then I got in my own mind saying, oh, what if I'm making this worse? Should I be doing this? So I back off on that and just not do that and start up with the icing again. And for a few days, I would feel great. I would wash dishes, I would try to do a fitness video, I would do it, and then I'm back to suffering with even more swelling and more pain. So this has become a chronic condition for me. Went back to the orthopedic doctor, second time for my recheck, and he just saw how much swelling and pain I'm having, and he recommended the cortisone shot. Yes, the cortisone shot. So I am here to tell you that a cortisone shot is not intolerable. It hurts a little going in. It is slow. They inject it slowly, and you will feel stiffness and some pain. And it took 48 to 72 hours to start to feel relief. It masks the pain. So just because you're feeling great doesn't mean you are cured. It just masks the pain. So he had recommended me to not overdo it because I may cause more damage. So yes, I had the cortisone shot a few weeks ago, and I'm starting to feel a little bit better, and I can actually visibly see the swelling has come down. So if you are offered a cortisone shot, it isn't bad. You will survive. It will help you. You will feel stiff for 3 or 4 days after, and a little bit of pain when you try to bend the elbow, but it's well worth it. It is tolerable. On to the next part of my recovery. He also recommended, instead of taking medications orally, instead of the naproxen and the Motrin, to try to treat the inflammation from the outside in. He recommended Voltaren, which is an arthritis medication applied to the outside of your injury or your arthritis. It is not made for sprains and strains and is not to be used on your back or your hips. And we'll get into that in a little while. I will show you the box and show you how I use it. It is wonderful. I've been only using it for about maybe 12 days and have had great results. I have had less pain and less swelling. So on to the next part, sleeping. If you have this condition, you know that when nighttime comes around, it's hard to sleep. It hurts. I've tried sleeping with my arm bent. The doctor recommended propping the arm up on pillows laying on the side. That is not affected. So sleeping with it bent was not a good idea for me because in the morning I would be even more stiff. So I decided to sleep with my arm like a stick. I'm going to sleep with a stiff, straight arm, and that didn't work. I woke up feeling even worse. So as I would recommend, as my doctor recommended, don't sleep on the arm that hurts. Sleep on your side or your back and try to prop it up. These are my results. This is my personal opinion. If you're suffering with this, you may have had a different result. You have a different opinion, and that's okay. This is just a video to let you know what I've been going through so that maybe we can connect and somewhere help. If I could help one person, that would be great. It's a great goal of mine. So sleeping, definitely it gets tight and it hurts. So prop it up on a pillow and make sure you do ice before you go to bed. I've been doing 15 minutes right before bed and it has definitely helped. On to the next part. Physical therapy has been a blessing. It really has. I know that I would shy away from some of those exercises because they started to hurt. The physical therapist is amazing, and everyone out there that is a physical therapist, God bless you. You are amazing. I don't know what we would do without you. She has helped me to push through with the stretching, but not to the point where I'm going over that line of pain. Stretching and exercises, they have helped. So after 6 months, I am finally feeling like I'm getting somewhere. As I said before, teaching live classes is my passion. I love that. We're going to get back to that. She said, just take it one step at a time. And I can see the light at the end of the tunnel now. And if you're suffering with this, I hope you can too. Don't give up and keep trying new things. Try different things. Go to the doctors, get the diagnosis, and follow what they're telling you. Because me, in the first round of going to the doctor, like I said, would do the exercises and I would quit because I started to feel a little better. And then I'd wash a boatload of dishes and fold a boatload of clothes, and then that movement would send me back to that pain, that really bad pain, to the point where I was in tears. Not only tears from the pain, tears of frustration. So let's get into the Voltaren. That is the next part of my video, and I will show you the dosage and how it is applied to the skin. So let's go on to that. This is my Voltaren. Although I would love to have Voltaren as a paid sponsor, they are not. I am not affiliated with Voltaren or the company that manufactures them. I am a paying customer, and I purchased this at Rite Aid Pharmacy for $24 US. I have seen it at Walmart. You used to have a prescription for it, but now it is over the counter. These are the areas of treatment: hand, wrist, elbow, foot, ankle, and knee. It is not intended for your shoulders, back, or hips. On the flip side of the box, they give you a nice informational area of drug facts. If you plan on purchasing this, I would recommend reading all of the instructions and all of the drug facts and interactions. So if you're taking this as an NSAID, you are not supposed to be taking an oral NSAID at the same time. It's one or the other, from what I understand. And here is the other side, which is a dosing card. If you're looking for immediate relief, this is not the item to buy. It may take up to 7 days to feel relief. I think I started to feel relief on the 3rd day. And you can use it up to 4 times a day, up to 21 days, unless directed by your physician. So this is what the box looks like. It does come with a sturdy plastic dosing card. And here is what the actual tube looks like. It's a silver tube with a nice little triangular shaped cap that comes off real easy. And the product itself is kind of like a creamy, clear substance. All right, so I am ready for a dose. I'm going to show you what it looks like. So you just get your dosing card. And since I'm applying this to my elbow, I would use the top area for upper body. Just going to simply apply that Voltaren to that top line, which is upper body dose, and the bottom is for a lower body dose, I guess, if you're using it for your knees or your ankles. So I'm going to just swipe this off. And it's so easy to just wash this off when you're done and put it back in the box. So there's my dose. I'm going to apply it to the elbow. I want to rub it in. I know that they had recommended not putting this on an area that has wounds, any type of cuts, rash, or infections. You want to let it dry. Don't want to put clothing or bandages over it. And you want to wait at least an hour to get a shower or a bath. That is their recommendation. So I have been using this, and I have found some really great relief with this. And like I said, they give you the nice packet, quick start packet, user guide. Here is what it looks like. So 2 dosing areas. If you're using it for your hands, they're recommending it just using it in 2 areas, not your ankle as well. I don't know the reason behind that. I'm sure there's a good reason. And you turn the page, and it shows you about applying the Voltaren. And like I said, avoiding a shower or a bath for at least 1 hour after use. And the 3rd page is all the warnings about stomach bleeding and liver warnings. So if you're pregnant or if you have these issues, you want to speak to your physician before you use this. So that's my experience with the Voltaren. I've had a lot of relief for the golfer's elbow with it. And now we'll get on to talking about the ACE bandage. The next form of relief has been this ACE bandage. As you can see, it has a custom dial. It's a custom dial elbow strap, and it has different support levels. Because of the dial, you can ramp up the tightness on the little area that they have. It's a premium gel pad. It's inside. I will show you that in just a minute. And I have found great relief with this. This I purchased at Walmart for $19.99 US plus tax. Just to let you know, it is affordable. Here's how it goes. Demonstrate this for you. I'm going to open up the Velcro. Inside you can see the additional strap I was telling you about. Going to slide this on the affected arm. I'm going to actually feel around until I feel that pressure point. Feel some relief there. And I'm going to put that little pad right there and tighten up, cinch up on this with the Velcro and close it just like that. And here's my dial. To get more support, I'm going to just click it where the plus sign is showing me where to click. And if you need to loosen up a bit, you just go the other direction. So this ACE strap has helped a lot. I use it a lot, especially if I'm doing dishes, because that rotation with the wrist, that internal rotation, I feel pain. So this is really helpful. And I would definitely recommend trying this. I'm not affiliated with ACE. Like I said, I'm just a paying customer and I have had great results with it. Hey friends, thank you for staying to the end of the video. If you've had this problem, please put it down in comments below and we can have a discussion on it. If this video has helped you, please give it a thumbs up. If you enjoy the content, give it a thumbs up and click that subscribe button. That would help me out greatly. I appreciate you and make it a great day.